Our next speaker is a fill-in for us. He's a replacement, and we are so happy to have him. I do want to let you know that City County Councilor Joanne Sanders was supposed to be here today. She sends her regrets. She was called away. You might be aware she is a member of an employee for the Stagehands Union, and there's a picket line over in Columbus, Ohio that she is manning as we speak. So she cannot be here. We miss Joanne. She has been a strong, strong advocate here in the city for so many causes. So she sends her greetings and wishes she could be here, but she's doing great work over in Columbus, Ohio. Pinch hitting for Joanne is someone who has recently returned to Indiana, and we are so glad he has. Gary Fritz is a native Hoosier who has been working in organized labor for over 30 years, and for more than 20 years he's been organizing. And let me tell you folks, that'll make you old before your time. He was returned to Indiana after holding the position of Midwest Director for the California Nurses Association and the National Nurses Organizing Committee in Chicago. He is now heading up the Indiana project to expand the unionized RN movement in Indiana. It's about time, Gary. Welcome back.
And speaking of organizing, I don't think I look too bad for 35 years of age. I mean, you know, it does take its toll. I've worked in Indiana in factories, I've worked on farms, and I've worked in the coal mines in Indiana. But today, I come to you on behalf of 150,000 RNs who make up the United American Nurses, the California Nurses Association, and the National Nurses Organizing Committee. Thank you for the invitation to speak to you today. This is a subject that the National Nurses Organizing Committee is very passionate about. Of course, that's single payer. In the last couple weeks, many of those nurses in NNOC have shown just how strongly they feel about the issue. When several were arrested when they confronted the Senate Finance Committee in Washington, D.C. last week. They were demanding to know why a committee to study ways to change health care in America would not even allow anyone to speak about single payer. What do they fear? They fear that as many people understand single payer health care plan, it is about more people who are asking single payer, why not? They fear that more RNs across the country will join the RN movement, and sooner real health care reform will take place. There are times that the only way you can measure your impact is by how much the other side pushes back. The blocking of single payer from the table at the Senate Finance Committee shows us that we are gaining ground. Every day I receive emails telling me about another local union or Central Labor Council that has endorsed single payer. We are moving forward. Now we must bring Congress and the President along with us. This fight is not going to be won by a slick media campaign or an army of lobbyists or even millions of dollars in campaign contributions. It is going to be won by talking to your friends, relatives, neighbors, co-workers, and your congressman. This is about health care, not health care for all, not insurance for all. Every day we see bankruptcy judges allow employers to walk away from their obligations to provide workers and retirees health care. Workers and employers are told they must compete globally with workers and employers in other countries. How is that possible when health care is not an issue in those other countries? If you want to level the playing field with other countries, start with health care. As a nation, we are going backwards. As Hoosiers, Look what is happening in our states. Workers in this state have less health care coverage than they did 20 years ago. A coal miner in Indiana has less coverage today than they had in the mid-70s, and no health care when they retire. Right now, union retired miners have better health care than RN nurses working in most hospitals. Is this progress? No! The people who are providing health care cannot afford the same coverage as the people they treat. Is this progress? No! We have retirees who have worked their whole lives for a pension that does not and the pension does not cover their health care premiums. Is this progress? No! Is insurance the answer? No! If it was, we wouldn't be having this rally here today. Insurance companies are the problem, not the cure. We cannot keep looking at patients as profits to be maximized. We need to get back to letting doctors, healthcare professionals, and patients decide what is the best treatment, not insurance companies. Healthcare should be a right, not a luxury for those who can afford it. Thank you.